program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
2 weeks after the second eye was done, my vision was nearly 20/20. And I'd been wearing glasses or contacts since I was 6 years old.
Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today we are focusing on your eyes. If you're watching us now live and you have vision and eye health questions, call us now. Your questions may be answered here live on our program by our expert. The expert answering your questions is Dr. Patricia Smith with Triangle Eye Physicians. To call us here at Rex on Call, just dial the number on your screen in Wake County. Call 919-744-3876. Outside of Wake County, call us toll-free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions to rexoncall@rexhealth.com. You can even find us on Twitter. Send us your question at RexHealthcare, hashtag RexOnCall. As you're starting to call in with those questions, here's a story about a new use for a technology that's been around for more than a decade. The same types of lasers used in Lasik eye surgeries are now revolutionizing cataract surgery. Rex Hospital is the only hospital in Wake County to offer treatment with a femtosecond laser, and we got to see it in action. Take a look.
Ron Clark had cataracts in both eyes.
Glaring at night, bright lights, and when I was driving bothered me. Looking up at a light, it looked like I was looking through a haze.
Surgery was his best option, and he chose a relatively new approach for cataract treatment. He chose the LensX laser at Rex Hospital. It completes the first in a two-part procedure.
It's absolutely pain-free. They put some drops in your eyes to start off with that burn, and that's probably the most painful thing that happened.
Just keep holding nice and still. You're doing perfect.
On this day, we got to see ophthalmologist and cornea specialist Dr. Patrick Labor at work.
So just going to be double checking your measurements here.
Under his guidance, the laser makes a precise circular incision on the cornea, which is the most difficult part of the standard cataract surgery.
All done. Everything went perfect. If I was going to have cataract surgery, I would use this newer technology. My mom was going to have it. That's what I have for my mom.
Dr. Labor says the laser even helps break up the cataract, which makes the second part of the procedure, the removal of the cataract, much safer and easier.
You can hear them up there setting their adjustments, and then when they get ready to go, they say, okay, we're ready. This procedure will take 41 seconds. And then it's like Star Wars. I mean, you just see all kinds of bright lights and stuff going on, and then they're through.
Ron had a shorter recovery, and get this, his vision is now perfect.
2 weeks after the second eye was done, my vision was nearly 20/20. And I'd been wearing glasses or contacts since I was 6 years old.
Joining us now is Dr. Patricia Smith with Triangle Eye Physicians. Thank you so much for being here. So you performed this same surgery we just saw on that same laser. So tell us, how does that really compare to a more traditional surgery, cataract surgery?
Well, the first thing you have to realize is that traditional cataract surgery for many people is an everyday miracle, that terrific results. 2.5 million people each year have cataract surgery in the U.S., and it's still a great operation. The femtosecond laser is really exciting because it gives us that next step forward. The cataract surgery now is so much different than what Grandma had, with long recovery and people waiting till their vision was quite bad to have it. But now, with the technology being good, it's still surgery, but the recovery time is better. Again, the femtosecond laser, which is the same laser that's used in LASIK surgery, but adapted for intraocular use, is now available, and it's the next incremental step into the future. It's safe, it's effective, and we've been just tremendously excited about it. We were very excited also that Rex acquired this technology for its physicians to use at the Raleigh campus.
And talk to us, you know, I remember my grandparents waited a really long time before cataract surgery. Is this something now people should consider sooner?
Anytime you're doing surgery, whether eye surgery or anything else, you always weigh risk and benefit. The benefit of the femtosecond laser is the precision of the operation, the ability to get even small amounts of astigmatism corrected at the same time the cataract is taken care of. So you want to weigh the benefits versus the risk. And now, not to be blasé about surgery, but with the risk of the surgery being much more manageable, much more predictable, much less, that equation changes. We got lots and lots of happy people. It's actually a unique surgery in the sheer numbers of people who have it and how well they do.
Okay, I already hear we're getting lots of questions on this, so let's get to another one that came in. This is by Facebook from Raleigh. What are the symptoms of dry eye disease, and at what point does it require treatment, and what are the options?
First of all, dry eye is more of a symptomatic description. By that I mean someone that has burning eyes or itching eyes or a little discharge or gets tired of the computer early. They think, I have dry eyes. Why do they think that? They put in some artificial tears and they feel better. But there are many reasons for eyes that feel dry, and that's why it's important to get someone to take a look at it when using the tears once, maybe twice times a day doesn't do the job. For instance, in younger people, the reason for burning eyes might not be dryness. For them, it's much more common to have allergy or meibomian gland, that's the oil gland that surrounds the eyes. They can be colonized, they can be inflamed. Meibomian gland disease, let's call it something more familiar, rosacea, is much more common as a source of dry eye symptoms in a younger person than an older person. As someone gets older, we think about other systemic diseases such as diabetes, thyroid disease, Sjogren's syndrome, for which there's now a blood test that we do in the office with multiple genetic markers that weren't available even a year ago. As somebody gets older, of course, medications might be more of an issue. And every medication you open up has something in the literature accompanying that it might cause dry eye. And I could go on, but you get the idea. There are mechanical reasons for it. So it's really good to get an examination of something very simple, like once or twice application of artificial tears doesn't do the job. So dry eye isn't just dry eye, and the treatment is extremely variable.
So get it checked out for sure.
Yeah, not to be self-serving, but dry eye isn't just dry eye. It may be medications, it may be something systemic, it may be something simple like rosacea around the eyelids, which is actually easy to treat now with some of the newer medications.
Okay, so talk to us. We have a question about children and how much screen time is too much screen time for their little eyes. You see, my kids included, you know, in front of a device.
Yeah, that's an interesting question. There's been research in the last decade or two. We've come back around to the notion that sustained near work can exacerbate, make worse, a naturally occurring tendency for nearsightedness. Now, this won't get your kids out of their homework.
Hear that?
But, you know, watching the TV out there versus an iPad or other device here actually makes them accommodate more. So if you need a reason to not let them do that hour after hour, that's one. As a parent, I think that if they're going to do sustained near work, some of that better be a book, because that's a different process in the brain. But I'm not an educator.
Well, but you're a doctor, and that's what I'm going to tell my kids. Okay, we're back after the break to answer your questions. Give us a call or send us an email. We'll be right back. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions regarding eye health. If you have questions for our expert, call in now. In Wake County, 919-744-3876. Outside of Wake County, toll free, 877-277-6252. Also send us your questions via email, rexoncall@rexhealth.com. Let's get to these questions because there are a lot of them. So Johnny from Franklin is calling. He has astigmatism. Can it be corrected? He's been wearing glasses since he was 6 years old.
Astigmatism, a lot of misconceptions about that. You have people who are nearsighted, people who are farsighted. Both of those types of folks can have astigmatism. All astigmatism, which means not on a line, is a corneal curvature where the curvature in one direction, that way, is not the same as the curvature at right angles to it. Think of a football, and it has an axis. And both cataract and refractive surgery, that is LASIK and photorefractive keratectomy, can correct astigmatism. It's important to make sure the astigmatism isn't from a disease called keratoconus, but a lot of the testing that we do before both those surgeries screens out keratoconus. So absolutely, yes, it can be corrected.
That's good news. Okay, after Geraldine from Johnson County calling, after cataract surgery, is it normal to have sensitivity to light?
Many people right after surgery, one of the first things they notice is their contrast is so much better. Their clarity should be better. The color vision, I've heard time and again, is amazing. However, sensitivity to light can be something as simple as dry eye, surface problems, which you should go ahead and correct, or very commonly after cataract surgery, the capsule that used to surround the cataract now is around the lens implant within the eye. That can haze over with a fine layer of cells, a so-called after cataract. And it's a simple matter to open that capsule, which happens in about 20 to 25% of eyes. It's an office procedure, takes 30 seconds. Safest thing we do, closest I get to a video game.
Oh, wow. Okay. So, this question's from Holly Springs. Do you recommend LASIK corrective surgery for farsightedness? What are the risks?
The risks of farsighted LASIK surgery, or PRK, the surface version of that, are no different than myopic or nearsighted correction. The problem is this: even though the myopic correction where you flatten the cornea, okay, it's a direct effect on the tissue, and it's stable. The people that you're correcting farsightedness, you're actually trying to get the cornea to be steeper, and that does not seem to be as long-lasting a result as the nearsighted. The FDA has approved farsighted LASIK for up to 6 diopters of farsightedness. However, most refractive surgeons say 3 diopters is tops. You have to watch out for tear film problems. So it's not as stable as LASIK for myopia. There's some other ways to correct that. If you're farsighted and you have a cataract, you're in luck. That is easy to correct, and it's stable.
Oh, okay. Yeah. This is questions from Sherry. Do vitamins and supplements help with presbyopia?
Presbyopia literally means old eyes. That's the process. You could be nearsighted, you could be farsighted, you could have the astigmatism, and have all that corrected, and guess what? Over the age of 40, you're still going to need something. I know you're not there yet, but...
No, I am, but that's so unfair.
It is unfair, but that reading thing will come into play, okay? A 40-year-old with otherwise perfect vision will need a +1 from the grocery store, or at a 50, a +2, a 60, a +3 magnifier. It marches up over the years. Some people are lucky and they don't seem to progress like that. But vitamins and supplements have never been shown to help that out whatsoever. So be wary of stuff that you read about online that purport to correct presbyopia. Okay. It doesn't work.
Oh, that's...
Not exercises either.
Oh, eye exercises? Oh, I'm about to find out. Okay, Sylvia from Sanford. She had cataract surgery in both eyes and has achiness in her right eye. Is there anything that can be done to correct this pain, or will it go away?
No, that needs an examination. There are many reasons for eye pain, including some dangerous things like glaucoma, for example. That's not something that can be answered in a format like this. you need to go and have someone look at it.
Okay. This partial vision and left eye, fluid buildup in the eye causing pressure. Would a laser surgery or would a surgery improve this, correct this?
I'm guessing that perhaps they have glaucoma.
Okay.
Possibly. No, that's all I can tell you. That needs continuing professional care. That's not something that you can wing it on your own. No supplement's going to help that. That being said, there are types of lasers that help with glaucoma.
But get it checked out. Okay.
That needs a look. Yes.
Okay. Coming up, we'll be answering more of your questions in Wake County. Call us at 919-744-3876. Outside of Wake County, toll free 877-277-6252. Email us your questions, rexoncall@rexhealth.com. Stay with us. We'll be right back. Welcome back to Rex on Call live here on WRAL. Today we are answering your questions on vision and eye health. To reach us, call one of those numbers you see on your screen or email us at rexoncall@rexhealth.com. Let's get right to it. Michelle from Raleigh, she's nearsighted, has double vision or halos around lights after computer use. She doesn't have cataracts. What could be the cause?
A lot of people that are pounding away on the computer and they're in their late 30s might be noticing their early presbyopia. Yeah. So sometimes you just have to embrace your mortality, and if she, like I said, that's mostly people that are right on the cusp of 40. She might want to sneak to the drugstore and buy a +1 lens and sit away from the computer a little bit and see if that's helpful. Very common problem.
Oh, goodness. Okay, yeah. This is Willie. He says he has floaters in his eyes. Can they be treated? First, what are floaters? We're getting a lot of questions on that.
Floaters are like the weather. We can talk about them, but there's not much to do about them. If you think of a spider web where the silk is placed evenly, it's almost invisible. Same sort of thing is happening in the gel of the eye, where the proteins are spaced exactly. With time and gravity and age, what happens is those proteins will coalesce, they'll clump together, and like the spider web, form different shapes that are made up of proteins. And they move. You try to look at these floaters, and they scoot away. A few floaters, the brain gets used to them. But if someone gets a lot of floaters at once, that may herald a retinal hole or tear. That needs to be looked at. But many people have floaters, and you can safely ignore them, except for the new floaters. If there's something different about those floaters, it needs to have a look.
Okay, so get those monitored.
Yeah.
Okay, Francis from Four Oaks has glaucoma controlled by eye drops. Is she eligible for cataract surgery?
The interesting thing about the glaucoma, which means the pressure that's too high for the health of the eye, very simplistically, is that study after study shows that when people have cataract surgery, their eye pressure will drop several points. In fact, someone who has mild glaucoma, say controlled with one medication, for example, has cataract surgery, we'll do a little drug holiday afterward, and often they can get off that medication.
Wow.
It seems to improve glaucoma control.
Oh.
No promises, but absolutely, she's still a candidate for cataract surgery.
Okay. Regina had cataract surgery with lots of inflammation in the eye, but has an autoimmune disease. Can the lens be rejected due to that autoimmune disease?
The modern lens implants, the materials out there are very inert. They're good for the long run. If she's having inflammation of the eye after cataract surgery, then they need to address and make a diagnosis about the inflammatory eye disease, okay? There's that. Sometimes, rarely, there are long-term chronic inflammatory problems with the cataract surgery. Pieces of cataract left behind in the eye. Rarely late infections. It's very unusual. So that needs a look, okay? But the lenses themselves, excellent materials. They could be misplaced in the eye, and that's something obviously that needs to be evaluated.
Okay. Anita from Clayton, her eyes bleed when rubbing them, and they feel funny. What causes the eyes to bleed?
Most people have nice white eyes like yours, gorgeous. But the thing is that there are some small blood vessels there, and this is a very low pressure system, and the capillaries can break easily. So if you rub your eyes, or even if you cough or sneeze, you may burst a blood vessel in the conjunctiva. Very common. Not a weekend on call goes by without someone calling up and say, I feel fine, but my spouse says my eye is bloody red. It's basically a bruise on the conjunctiva, and it looks really bad because it should be nice and white, but this will pass. If it keeps happening time and again, of course, you need to check the health of your blood. But try not to rub your eyes, and a little subconjunctival hemorrhage happens, that'll go away on its own.
What about the eyes that are always bloodshot? When does that need treatment, or does it need treatment?
That's not normal. The eye's reacting to something, and remember what I told you, dry eye, if you must call it that, but you need to go into depth. Is it allergy? Is it rosacea? Is it, well, tumors are very, very rare. But red eyes are telling you something. They're saying, help me. And I think it needs an evaluation of, by someone that knows what they're looking at. So, no, it's not normal. It should be evaluated.
We're going to have a final round of questions right after this break. This is Rex on Call. Welcome back to the show. This is Rex on Call. We're taking a final round of your eye health questions right now. LASIK surgery. If you have astigmatism, are you eligible for LASIK surgery?
Yes, remember before when I said it's more like an egg? That is absolutely not a problem. So you got that astigmatism, you even it out, and then you flatten the cornea. It's all part of the process and very straightforward.
Okay, and the LASIK surgery, what's the recovery like for that?
LASIK is really quick. LASIK is where a flap is lifted.
Mm-hmm.
A flap is lifted, you laser, you put the flap back down. And I have plenty of folks who are 20/20 the next day.
Wow.
Okay? It's really very quick recovery. Other people who elect for the surface version of that, we take the surface off, laser, I know, it sounds weird. Put on a contact lens, and then place where I scraped off the cells closes in, but there's no flap, all right? A little bit more evolutionary type healing, but I've had it myself, so I'm drinking the Kool-Aid. So that's called PRK, or photorefractive keratectomy. But most people are back to work, doing their thing, get them through the post-op period. Very little downtime from work.
And so it's up to you and your surgeon what type of surgery you would get at that point?
It depends on the preoperative evaluation. I have to say the so-called thin flap LASIK, which is created, the flap is created with a femtosecond laser, similar to the one that's used for the cataract surgery. The recovery time for that is really, really fast, excellent. The flaps don't slip. That and the surface version of that some people elect to do because they're in the military, even though the military has approved the laser-assisted LASIK, they are such comparable surgery nowadays. It kind of reflects patients' comfort with the flap versus no flap. And it may even come down to price because you need a second laser to do the all-laser LASIK, which is all I do. I don't do the LASIK with a blade.
Okay.
It may come down to price, and it may come down to whether or not, once you explain it to them, the flap is something that they can deal with.
Okay.
And they all do very well.
Okay. We have one more minute here. Ruth Harris from Dunn. Night blindness and sees halos around headlights and streetlights. What is this?
For most people that see halos around headlights, either you have refractive error, and by that I mean nearsighted, farsighted astigmatism uncorrected, or at a certain age, that is a sign that you have some early cataracts. If you look at a light and there's like a little bit of a halo or a glare, that could be an early cataract.
Okay, so get in and get that monitored, sure. As always, consult with your physician about any health concerns. And if you're looking for a doctor or need a direct referral, call Rex Health Net, Rex's free telephone information service. The number is 919-784-4490. Thank you, Dr. Smith, for being
welcome.
here and fielding all of these questions into our phone bank that's still taking calls over there. And make sure to join us next month for Rex on Call. Our topic is women and cancer. That's September 15th at 1 here in WRAL. Email us your questions ahead of time to rexoncall@rexhealth.com. We'll see you next time. Thank you so much for joining us.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.